You may have heard someone say the hospice nurse came to your house almost every day. Then you look at your loved one's care plan and the nurse is scheduled only once a week. Now you're wondering, is once a week enough? Is something missing? Did we choose the wrong hospice company? Hospice care is not one size fits all. Two patients can have the same illness and still need a very different visit schedules. Today, I will explain who is on the hospice team, why each person is there, and who decides how often they visit. Hi, I'm Rupal. I'm a registered nurse with experience in hospice and palliative care. Today, we are going to talk about the hospice team, who is included, why is each person there, and who decides how often each team member visits. We'll also talk about a federal agency called CMS, Center of Medicare and Medicaid Services. Understanding the basic CMS rule can help you know what every Medicare-certified hospice must provide and what depends on your loved one's individual needs. One important note: this episode explains how hospice works in the United States. Hospice services and insurance coverage may work differently in other countries. Some countries may not provide insurance coverage for hospice at all. So what is CMS? CMS stands for the Centers of Medicare and Medicaid Services. It is a federal agency within the United States Department of Health and Human Services. For this episode, we're focusing on Medicare and Medicaid hospice care. CMS sets the federal rule that Medicare-certified hospices must follow. These rules explain what service the hospice must provide, who must be part of the main care team, and how the patient's care plan should be reviewed. It's not a cookie-cutter situation. The schedule is based on what that patient and family need. That is why one family may see a nurse several times a week, while another family may see a nurse once a week. Federal rules say every hospice must have a main care team. You may see this called the Interdisciplinary Group, or IDG. That is simply the group that works together to plan and review your loved one's hospice care. The team must include these four main professional roles: a physician, such as a hospice medical director or another hospice physician, a registered nurse, a social worker, and a non-denominational chaplain. Now, this team works together to develop your loved one's care plan. The care plan explains what help the patient needs, which services will be provided, and how often those services should happen. The team must review and update the patient's needs and care plan at least every 15 days. They should also update it sooner when the patient's condition or needs changes. Other team members may also help with your loved one's care, and that may include a hospice aide, sometimes called a certified nursing assistant, who may help with bathing and personal care, a nurse practitioner, a bereavement counselor who supports the family with grief before and after the patient's death, a hospice volunteer, a physical, occupational, or speech therapist, a dietitian, a music therapist, and a pharmacist. Now, not every patient will need visits from every person on that list. These services are added when they are needed for the patient's comfort, safety, symptoms, personal care, or family support. The important thing is that your loved one's needs should guide the care plan. So now, who decides how often the team visits? This is the part that surprises many families. CMS does not set one routine visit schedule for every hospice patient. It does not say that every patient must receive 3 nursing visits a week or 2 aides visits a week. So it's not defined by CMS. How often a hospice team member visits depends on what your loved one needs and what is written in the care plan. So when someone tells you, our hospice nurse came 3 times a week, that may have been right for their loved one. But it does not mean every hospice patient must receive the same schedule. For example, 2 patients with Alzheimer's dementia, one with no skin breakdown, no infection, eating 50% of their meals, family is managing well, and their routine is set. This patient and family might need nurse visit once a week and an aide visit once a week. Maybe a volunteer visit once a week where family can go out and get some grocery shopping done or have coffee with their friend just to get some fresh air. Another patient with same Alzheimer's disease has multiple stage 3 and stage 4 wounds, eating 30% of their meals, moaning in pain with movement where family is lost on how to keep their loved one with least or no pain, and this can require frequent visits from different team members. 2 to 3 nursing visits to manage pain medications, as it might need alteration to the doses until patient is comfortable. Wound dressing change, 8 visits 2 to 3 times a week to support shower or bed bath, changing sheets, teach family how to change patient's position every 2 hours to prevent further skin breakdown. This family can further benefit from a social worker, a chaplain, and a volunteer visit, but it would be family's choice to choose or decline on those extra services. All these care and services are documented and reported to CMS to justify the visit needs. Again, 2 people can have the same diagnosis and still need different care. Hospice care should be based on what the patient needs right now and not only on the name of illness. So what do the CMS rules say? The registered nurse completes the first hospice assessment and helps coordinate the patient's care. After that, the nursing schedule is based on patient's condition and care plan, as we saw in the example. The social worker visit based on the patient's and family's emotional, social, financial, or caregiving needs. The chaplain or spiritual care counselor, those visits are based on patient's and family's wishes. A patient or family can accept or decline the spiritual support. The patient and family can accept or decline the volunteer support. So, when should visits increase? If your loved one's condition changes, the hospice should check what is happening and decide whether the care plan needs to be changed. Visits may increase when there is more pain, trouble breathing, more confusion or restlessness, new skin problems, more help needed with bathing or personal care, a sudden decline, or a caregiver who is having difficulty safely managing the patient's needs, or the caregiver is sick. Sometimes visits increase to several times a week. In certain situations, support may be provided daily, but daily visits are not automatically provided to every patient from the beginning. The hospice team is not normally in home all day, every day. Family members or other caregivers usually provide most of the hands-on care between the hospice visits. The hospice team provides teaching, support, symptom management, equipment, medications. Those are related to terminal illness and visits based on the care plan. So what should family ask? If you're concerned about the number of visits, you are not being difficult by asking questions like, what is written in my loved one's care plan? Why was this visit schedule chosen? What changes should cause the visit to increase? Who should I call if symptoms suddenly get worse? And can the care plan be reviewed again? Fewer visits do not always mean something is wrong, but you have the right to understand the schedule and ask for another review when your loved one's needs change. If your loved one has received hospice care, did anyone clearly explain who would visit and how often? Share your experience in the comments. Your answer may help another family understand what to ask. If this video has helped you, please share it with a family member or caregiver who may need it. And if you have not subscribed yet, please subscribe. I share a new video every week. I hope this helps you understand how the hospice team decides who should visit and how often. For more information about the CMS hospice guidelines, I have included the official CMS link in the description below. I'm Rupal. Thank you for watching, and I'll see you next week.